Welcome to Voices in Value-Based Care. I'm Beth Houck. Thanks for tuning in. The movement to value-based care is revolutionizing how healthcare providers get reimbursed for delivery of care. In this program, we're going to explore stories from the field about how real organizations are dealing with this change. You can follow the show on Twitter at #VoicesInVBC and follow me on Twitter at @BAHouck. On the program today, I talked to Lucy Zielinski, Managing Partner of Lumina Health Partners. Lucy, welcome to the show.
Thank you, Beth. I'm honored to be on today's program.
Well, I'm really excited to talk to you because I know that we've been navigating the healthcare landscape for years together and commiserating and talking about all sorts of things, including interesting technologies that have been developed, changes in the market, what government's providing or giving to us. So I think this is going to be a really fun conversation, and I look forward to hearing some of your newer perspectives as well. So just to get rolling, why don't you go ahead and tell everybody a little bit about yourself and about Lumina?
Great. Thanks, Beth. As Beth said, I'm Managing Partner of Lumina Health Partners. This will give away my age, but I've worked in the healthcare industry for about 30 years now with health systems and medical groups, focusing really on that strategy, operations, revenue cycle, as well as value-based programs like MIPS. In addition to that technical work, what it really interests me, probably in the last decade or so, is helping organizations on the people side. So I've been involved in many transactions, mergers, acquisitions, as well as like change management, coaching, and leadership development. And then at Lumina Health Partners, we offer consulting services and leadership programs to help organizations on their value-based journey around really four core service areas. We focus on strategy, including development, formation, and optimization of clinically integrated networks and ACOs, digital innovation and analytics, clinical transformation and leadership programs. We have a team of expert consultants, and all of them have over 20 years of healthcare experience, and most of them have worked as senior leaders in CEO and CMO roles. And I think, like Beth, you just mentioned, healthcare is experiencing so much change, and we realize that our clients need some assistance in navigating this change. So we help them with this change and focus on the value-based care journey. We believe that one of our key differentiators is really integrating the technical consulting or advisory services with change management and people skills. This really allows our clients to be better equipped to transform healthcare today.
Your breadth is awesome, and I know that you've touched so many different organizations in your career, so I think this is going to be a really interesting conversation. Let's start off by talking about what kinds of changes you're seeing on the almost structural side to organizations in support of new value-based care arrangements. So let's just talk about some of those kinds of changes that are being out in the market.
Sure. So as you know, value-based care requires this keen focus on the triple aim, right? Providing better quality patient outcomes while bending that cost curve. And we've been doing this for a number of years now, and we're learning more and more. I think one of the key lessons we're learning is this is not done in silos. If you think back, 20 years ago, physicians were in one pod, hospitals were in another, nursing homes were another, and everybody was working in silos. And I believe that value-based care is truly a team sport. It requires collaboration across providers of care in all settings. I mean, if you think about it, it really starts from that doctor's office in the ambulatory care setting to the hospital to the post-acute setting, and then effective transitions from one setting to the next. So coordinating care across the continuum and across all of those settings is really key in value-based care. For that reason, I think the type of organizational models that are thriving are those whose strategic goals and objectives are aligned. We have seen much success with clinically integrated networks and ACOs that are physician-led, so physicians are definitely involved, and those who have stronger alignment with specialty groups and hospitals. So again, everybody working together. Secondly, many small groups or local groups have limited access to capital. And so they leverage service organizations for infrastructure support. So think about the MSO-like organizations or population health service organizations. Alternatively, we see the smaller groups joining larger regional CIN-type organizations. And then we also see an increase in clinical service models around, say, an expansion of a cardiac or ortho service line to build an advanced care model with capabilities that really extend across that care continuum. These models really support the management of chronic conditions as well as bundles by decreasing that clinical variation. So all of these value-based care models or infrastructures, if you will, require the integration of not only capabilities like HIT and reporting and data, but care management functions where all of the people are working together. And one of the things I often think of is I use a metaphor. The metaphor I use is that of a sandbox. So if you think about sandcastle building, go back to those days, or maybe you still do it today, but I think you would agree that it takes a team to build an amazing sandcastles, right? There's many layers and water features and landscaping elements. And similar to care delivery, it takes a team to take care of that one patient, especially the patient with chronic conditions. And that team, in delivering care to the patient, they need to play nice together in that sandbox. They need to communicate effectively, plan and prioritize activities, shift when something fails. So people need to work together to provide patients really that right access to the right specialty, to the right setting at the right time. And we've heard that over and over again. And many organizations today have adopted a dyad administrative model where executive and clinicians are partnered up to lead the organization. I think this is very effective. But no matter where an organization is on its value-based journey, and we see so much variation across the country, but what I can tell you is that strong physician leadership and governance are key to all of these value-based care infrastructure models.
So you just made your way exactly to one of the questions I was going to ask you about when you started talking about these different models and these people playing in the sandbox. Ultimately, this is about people, and kind of continuing your metaphor, I know that there are those folks that have really cool shaped buckets that don't want to come in the sandbox to help make the castle prettier. So how do you deal with that people aspect of things? Like what's the consequences to creating all of these structures, and how does that generally end up impacting the people that have to play in there?
Yeah, great question. There's a lot of uncertainty, right? Change is hard. And the shift to value-based care are requiring organizations to take on more risk, right? For a while there, they were doing upside, and now they're doing downside risk as well at a faster pace. And value-based care requires organizations to do things differently. And then people have to think differently, and people have to work differently. And change is really hard for people. You know, I think of myself, and I remember I had a BlackBerry, and I really didn't want to change to an iPhone. And it took me a long time. But then when I flipped over to the iPhone, I loved it, right? And now I can't imagine life without it. It was hard at that time to make that transition, but once I made it, it became my new normal. And so change is really hard for people. And if you think about it, people have to want to change, or they're just not going to. And we all do it, right? If we don't want to do something, we're just not going to, or we will resist, or we'll create drama. I think of my kids often there. But having a good plan, organizations need to have a good plan and a technical solution. But that's one thing. Getting people on board and accepting and supporting that change is another. And that's the hard part, I think. Studies show that more than half of change initiatives fail because people resist change. People are wired If you look at the neuroscience, they're wired to resist change. And as a result, this causes organizations not to only lose dollars due to, let's say, decreased productivity and employee turnover, but the reputation of the organization is at stake due to lower morale. Think about it. Employees typically see change as undesirable because they really didn't choose it. They had no part in it. And it's very disruptive to their workflow, to the way they do things in their work environment. And fear and uncertainty take over. We all do this. We all wonder, and employees are wondering, do I have a job? How will this affect my position? Will I be able to pay my bills? And really, what's in it for me? What's changing? So these primary questions, if they're not addressed, they cause negative emotions in people. And that may result in employees delivering poor service and care to patients. And that's something, obviously, organizations don't want. So could you imagine the negative comments all over the internet, not only from patients, but from employees or ex-employees if they're not satisfied? This is definitely a high stake for any organization trying to achieve the triple aim and be attractive in the market among many competitors. So I think leaders have to be prepared to respond to change for the organization to survive and thrive under these tumultuous transitional times. One of the things I believe is that physicians need to be involved. They need to be equipped and take the lead to support change because much of the change involves the delivery of care.
Well, let's talk about the clinicians a little bit. You talked about your dyad model and talked about that as being something that was really effective when you're trying to drive change. So I want to hear a little bit more about how driving change with clinicians might work differently. As a side note, I also really love that BlackBerry keypad and really kicking and screaming. And I'm wondering if that kind of change with clinicians is even that much more acute. Tell me a little bit about driving change with clinicians.
Well, that's funny. Change is hard. I've said that again over and over, and I'll say it again. Change is really hard, especially for physicians. If you think about it, physicians are taking on more and more executive roles today, right? They're switching from that doctor hat and putting on the administrative hat. Well, being an administrator is a lot different than being a clinician. The physicians in these executive roles, these roles require less of the technical skills and more people skills. However, physicians are typically chosen to be leaders because of their reputation and their clinical skills, but they have little management training or experience. I don't think they teach that in medical schools. I think as a result, few physician leaders get formal instruction and really grow their leadership skills, especially around change management. And one statistic that I heard recently is 87% of people fail or succeed because of personality. And I think this is where it's key. Physicians need to learn new skills as they move into these executive positions. Physicians are natural problem solver, right? They assess a situation quickly, they find a diagnosis, and immediately move to a course of treatment. This recipe or this approach can be a disaster if a physician tries to lead change initiative that involves people. Because when we're working with people, there's different things that are important, right? It's not that diagnosis and quick plan that's important. Collaboration is important, right? I think resiliency is another characteristic that's important. Self-awareness, how a physician is leading and shows up and communicates to others, right? Are they driving their agenda? Are they driving the organization's agenda? Are they listening to people? Are they asking good questions, or are they just telling? I think humility is another key word that's needed to be a good leader. And then for physicians really to manage up. So those are some of the things that I think are important in a value-based environment for physicians.
I'm sorry, I was just going to ask, do you have any examples? Do you have any stories of clinicians that you've really seen employ some of these characteristics in an effective way and therefore seen the results?
Yes, what's interesting is I think of one example where the CMO contacted me to mention that he had a physician employee, a leader, and this individual had a hard time working with other people, especially the nursing staff. However, the CMO really felt strongly in this position and wanted this position to be a leader, but realized that there were some traits that could use some development. So after doing some coaching, and we did some personality profiles, behavior style identification, it was interesting. This physician realized that because of his upbringing and his training, he showed up with all the answers, knowing everything, and he thought that's the way he was supposed to act. And after realizing that what's required is his ability to collaborate with other people and ask the nurses questions, what do they think, and work together as a team. Once that was brought to his awareness, I mean, it was such an aha moment for him. He went back to work and he said, I'm changing this immediately because I didn't realize I could just be myself. And we said, absolutely. Just show up as yourself, work together with people, and it made a huge difference in his leadership style.
I love that story because, I mean, how many times do you think, wow, how simple the solution is? I get to act it as myself, but he had his preconceived notions about what he was supposed to be or who he thought he was supposed to be acting like. That's great. We talk a lot about organizations that are trying to decide whether or not they're ready to move to an ACO or ready to, and I say ACO, but I also mean the SINs or any other structures that have to be put in place so that everybody, I'm continuing, this is playing in the same sandbox. So how do you talk to those organizations, or what sort of considerations do they need to think through when they're deciding whether or not they're the right group to do this?
Yes. So when we think about embarking, for any organization to embark on a value-based kind of arrangement, some of the things I think about is organizations need to realize that change is occurring, right? And creating trust in the organization is so important. Organizations need to focus on building that trust. How they do that, I think, is one, creating a change team. Realize that change is occurring. And when you create a change team, you'll definitely want to include those change champions, those folks who navigate change well, and those who others respect. But then on the flip side, I would also include those naysayers because they share the thoughts of the people who are resisting. And that information will be valuable as it will provide you insight into what others are thinking and prepare you to address their concerns as you roll out that change. I think there needs to be a compelling reason for change in order for people to change and move with the change. The question that comes up is why change? You have to provide a good answer to others in order for them to accept. I worked with one organization that was implementing an HIT system, and I provided one-on-one coaching to the project lead. And that coaching really helped that individual process the issues more effectively and deal with the stress, because as we all know, there's always stress that is apparent with any type of change. And then through that coaching relationship, this individual was able to handle the conflict. I think another key piece is communication. And again, this sounds very simple, and we all know that communication is important, but in change, it's even more important when change initiatives are occurring. I don't think there's any such thing as over-communication. People want to be well-informed so they can prepare for and anticipate change. I recommend using multiple channels to communicate. Some examples are not only your written communication, like emails or even using social media platforms, but then like lunch meetings and webinars and town hall meetings, weekly or even daily updates, depending on the change. One of my clients actually had the CEO do a weekly type vlog type video to discuss the weekly updates. I think of another example too is I had another client who set up an anonymous online Q&A type tool. where employees would be able to ask questions and then receive answers anonymously. And many organizations today can leverage technology to digitally communicate. And I think with the millennials, with the younger folks too, I think that's key. That's how folks are communicating. But I think that consistent message to minimize that uncertainty and fear is important. And then I think lastly, organizations need to train their leaders around such topics like change management, self-awareness, stress reduction, empathy, and conflict management. In this value-based environment, physician leaders, if you think about it, they speak differently, right? They need a new set of common language as they're working in these dyad models. Some examples I think of is ROI, KPIs, HCAP scores, TDIS, ACCs, RAF scores, and the list goes on. So I believe that developing physician leaders and working with the rest of the staff to develop not only that awareness that change is occurring, but including them to participate in the change and build that trust, it really, I think, can be a differentiator that sets apart one organization from another.
Lucy, you talked about a whole bunch of different kinds of ways that communication can be really effective. So consistency is one of the things I heard. I heard you talk about being creative about how you deliver the message, in particular in using social media and videos and ways to communicate to different generations of listeners. I heard you talk about consistency and making sure that everybody's kind of saying the same thing. Can anybody be delivering this message, or do you have best practices around who you think should be delivering these change management messages?
Yeah, great idea. I always believe it comes from the top down, but then involving a team and involving others, including physicians and key people within your organization. I think, as I mentioned earlier, those resistors are your best supporters. So if you can involve them early on in the change process, they will probably deliver the best message to the rest of the folks. So I think it's a mixed bag.
That's great. Let's talk about advice going forward. Okay, so we've covered a lot of ground, and we know that most of the people listening to us are probably folks that are either in the middle of this change or are starting to embark on it. How long does all this take? Like how do they know when to start and stop? And what sort of advice would you give people?
As far as starting and stopping, starting before change occurs, right? Before the buzz of the initiatives goes out to the employees. One of the things I always say is you want to be the first one to tell your employees that change is occurring. The worst thing for employees to hear is that change is occurring from somewhere else or from media. So informing your staff is most important. Informing them early on. And then how long it takes, that just depends on the change initiative. So depending on if it's a short project, right? So if we're changing something minor like an email, tool or something like that, that's one thing. But if we're changing and relocating people and have a new facility or new building, that's a bigger change. So that will obviously take more time. So there's no canned answer for this. I think having that change team, like I talked about earlier, and almost having a retreat with a change team and asking the people, asking the employees, what do they need? What are they hearing? And then building a plan, a roadmap together, I think is important.
Well, thank you so much. And really thank you for all of your insight. There's so many different nuggets in there that I'm really excited that we were able to cover this topic. Lucy, we've covered a lot of really, really great topics, and there's all kinds of nuggets that I think people can just grab onto and take going forward. But with some parting words, where would you invest for the longer term? So if you were giving advice to the listeners, your parting words, where would you tell them to invest for the long term?
Yeah, I would definitely invest in the people. People are a valuable asset to any organization. And I think organizations need to treat them as such, especially during any change initiative. And all of these changes, especially as we're moving into value-based care, I would recommend organizations perform a readiness assessment. They're doing this, evaluating their technical skills, but the people part should also be assessed, right? Some of the questions that come up for me are, does the organization have effective physician leaders? What's the culture of the organization? Are leaders adequately equipped to lead and navigate the change? How effective are our teams? What support structures are needed to manage the change? People really need to understand, why are we changing, how is the change happening, and what is really changing. And once organizations perform that assessment, a roadmap or a plan, like I mentioned earlier, should also be developed. And the plan could include things like educational or learning development sessions for staff as well as physicians, one-on-one coaching or mentoring, as well as individual and team-based assessments to improve that team cohesion, because you want a strong team moving forward. So I think value-based care requires organizations to work together to build that brand and customer loyalty. And I think the only way to do this successfully is to build up your leaders to navigate change successfully and build that strong team on the foundation of trust. So I would encourage all organizations to invest time, effort, and resources in supporting leadership development and change management. And I think you will have better chance of success. But then in addition to that, employee and patient satisfaction scores will improve. We often hear of net promoter scores, that will improve. And then potentially better patient outcomes overall. So addressing that people part, I think, is critical for organizations.
Thanks, Lucy. Those are great last words of advice. Thank you so much for your time today, and thanks to our audience for tuning in. You can learn more about the show on the programs page on healthcarenowradio.com and lend your voice to the conversation on Twitter at #VoicesInBBC, and be sure to follow me on Twitter at BA Houck. I'm Beth Houck, bringing you the voices in value-based care you should hear. Until next time, have a great week.